Whenever you're ready, you can start.
Nursing is a common occupation that many strive for. However, the COVID-19 pandemic has changed the way the healthcare field is seen, and many people now go into a different educational direction. Due to the numerous changes from the virus, mental health has decreased and burnout rates have increased during the COVID-19 pandemic. One day, nurses went from wearing gloves to not only wearing gloves, but also gowns, face shields, goggles, and gloves. There are several different mental health problems that arose or worsened during the COVID-19 pandemic. Hello, I'm Beane, and I'll be exploring the topic of how does the COVID-19 pandemic affect mental health and burnout rates for nurses in the tri area. Before I continue, I would like to go over important definitions to get a better understanding of the research. Nurses, for the purpose of the study, is defined as a person trained to care for the sick or infirm. Throughout the COVID-19 pandemic, mental health has been affected. COVID is a virus that originated in China and spread across the world. Symptoms may occur 2 to 14 days after exposure and can include shortness of breath, difficulty breathing, fever or chills, and loss of taste and smell. Mental health is defined as a person's psychological or emotional well-being, and nurses also experience burnout, a long-term stress reaction marked by emotional exhaustion, depersonalization, and lack of personal accomplishment. My interest sparked in this topic because my mother is a nurse and I saw the mental toll that the COVID-19 pandemic had on her. When the COVID-19 virus began in March 2020 in the United States, healthcare workers responding to the spread of the COVID-19 virus reported high rates of stress, anxiety, and fear. According to Angie Karasik, a credible author for the World Health Organization Classification of Diseases, in a cross-sectional survey, it has been proven that increasing in cases, an insufficient amount of personal protection equipment, extremely demanding workloads, and a lack of adequate therapies to save lives contribute to the psychological burden related to the COVID-19 pandemic. Additionally, Karasik explained the amount of work that nurses do has increased dramatically because of the constant mask wearing and precautions from having to work with the positive COVID-19 patients. Mental health has come to the forefront during this pandemic. While working in a hospital, for example, one may be surrounded by nurses that are experiencing nurse burnout or have quit. Therefore, nurses that are still working will be doing twice the amount of work. This led me to find the gap in the correlation between COVID-19 pandemic, mental health, and the burnout rates of nurses. Nurses play a vital role in the world today while caring for the positive COVID-19 patients as well as other patients. Nurses need to be evaluated to see the underlying effects that COVID-19 has had on them. In order to understand why this study analyzes the experience of nurses during the COVID-19 pandemic and how they influence nurse mental health and burnout rates, it is important to look at the existing body of research. The significance of this research is to be informed on the topic of nurse mental health and burn rates during COVID-19, considering it has such a large impact on how the world is today. Nurses, as well as other frontline workers, work through tough conditions in order to properly care for their patients. Being aware of this mental toll is just the start of helping to resolve the issue. There is hope to inform the non-medical community, as well as the medical community, of the effects that COVID-19 has had on nurses. This research will allow nurses to admit their traits that have come about or worsened because of the COVID-19 pandemic. As I began the research process, I realized I need certain tools in order to complete. This includes a list of questions, a source of technology, whether it be a computer or cell phone, and an email address. I supplied a list of questions by Google Form to the participant through their email. There was a series of both open-ended and closed-ended, and the recipient's information remained anonymous and will be held confidential. This study was initially going to be designed to be an interview. However, a study of this field can be too personal, which ultimately led me to transition from an interview to a survey. I will be provided with quantitative data from the method that will further my research. Using this method, the research hopes to identify the mental health changes from before the pandemic compared to after, and the burnout rates from before the pandemic compared to after. I distributed the survey through the head nurse working for Advanced Home Health. The head nurse then distributed the survey to the 12 nurses working at the High Point location. The survey will be sent solely to the nurses that have worked before the pandemic started and during the pandemic, with the goal of comparing statistics and effectively seeing the difference. The initial target of this research was based off Randolph County. Advanced Home Health is an agency of nurses that travels to patients' residents in order to care for them. Due to the amount of travel from these nurses, I transitioned to Randolph County, including Randolph County, High Point, and Greensboro. I chose the High Point location of Advanced Home Health to conduct my research. Nurses could choose not to participate in this research and could choose not to answer any questions they didn't feel comfortable with. Nurses could also choose to stop taking the survey at any time. The research is hoping to gain an understanding of how much or if mental health and burnout has changed due to COVID-19. However, there is limitations due to the use of this method. There is the risk of the participant being dishonest, lack of personalization, and some questions may not be answered. Furthermore, the survey is limited due to the number of workers located at the High Point location. The survey was sent out to 12 different recipients, and 9 responded, but overall the survey was successful. There were 14 different questions asked regarding the mental health and burnout rates of nurses during the COVID-19 pandemic. The recipients were asked a series of questions to get a better understanding of how each recipient was affected, including the location of where they worked at. All 9 recipients were located in the Triad area, including Randolph County, Greensboro, and High Point. The survey began by asking the recipients where they worked to see how it affected the individual depending on where they worked. The survey revealed that the majority of the recipients worked in High Point and Greensboro at 66.7%, 44.4% work in Archdale and Trinity. In Asheboro, there was 33.3%, 22.2% in Randleman, and 11.1% in Liberty. The next question was, are you working directly with COVID-19 patients? To ensure that they have been working directly with COVID-19 and they are able to compare the difference from before the pandemic compared to during. These questions revealed that 100% of recipients work directly with the COVID-19 patients and therefore understand the extra equipment that is being used and the work increase while working directly with these patients. Nurses have to wear an N95 mask, face shield, gowns, gloves, and goggles to protect them, as well as other patients from this COVID-19 pandemic. Anxiety, depression, and stress are all mental health symptoms associated with the COVID-19 pandemic. In order to explore how nurses have been affected, the survey asked, have you experienced an increased level of anxiety while working during the COVID-19 pandemic? Have you experienced an increased level of depression while working during the COVID-19 pandemic? And have you experienced an increased level of stress while working during the COVID-19 pandemic? These questions revealed that 88.9% of the recipients have experienced an increased level of anxiety, with 11.1% of the recipients stating they have not. 33.3% of the recipients have experienced an increased level of depression, and 66.7% of the recipients have not. And lastly, 100% of recipients have an increased level of stress. After being asked, do you stress about the risk of spreading the virus? 66.7% of the recipients said that they do stress about spreading the virus, and 33.3% do not stress about spreading the virus. The recipients were told if you experience stress during the COVID-19 pandemic, please specify. The recipients specified what caused their stress levels to increase, with the majority of them stating that they stress about bringing the virus home to the family and friends. Others stated there are less resources, limited personnel everywhere, longer hold times trying to reach MD offices, and limited supplies. Another recipient stated, you never know what you're going to run into. Often see a patient and find out the next day they woke up and are sick and are positive. When being asked, do you stress about contracting the virus? 56.6% of the recipients do fear contracting the virus. 44.4% of the recipients do not fear contracting the virus. The results of the survey show that the majority of the people experience both stress and anxiety. However, only a third of the recipients experience depression. The next question is, have you experienced an increased burnout level while working during the COVID-19 pandemic? The recipients' responses show that 77.8% of the recipients have an increased burnout level because of the COVID-19 pandemic, and 22.2% do not have an increased level of burnout. This transitions to the question of, has the nurse-to-patient ratio changed since the beginning of the COVID-19 pandemic, as it could have been affected because of the burnout rates? The answers revealed that 44.4% of the recipients don't know, 22.2% of the recipients believe the ratio has not changed, and 33.3% of the recipients believe the ratio has changed. When being asked, do you believe working during the COVID-19 pandemic has changed the amount of workload you have? The recipients' responses show that 66.7% of them do not believe the workload has changed, and 33.3% believe that it has. The recipients that responded yes to this question were asked to specify how the workload has changed. The first recipient stated, there is a major nursing shortage, and we are having to cover more patients and territories in the same amount of time. Or our nurses are becoming sick, and we are having to cover their assignments until they are well enough to come back. The second recipient stated, short staffing is a major issue. Lastly, the third recipient stated, it is back to expected now, but in the first 6 months, pediatric referrals to protect them, we saw more pediatric referrals to protect them from doctor's office, etc. The next question is, do you feel like you have adequate emotional support? The recipients' responses revealed that 56.6% of the recipients do have emotional support and 44.4% do not. The last question in the survey was, what are your personal home-related stressors while working during the COVID-19 pandemic? The recipients' responses revealed that 77.8% believe they are taking the stress out on their family. There are 55.6% that believe their stressor is they're too tired to work, do chores, and worry/have guilt about affecting household members. 44.4% of the recipients believe that their stressors are inconsistent work hours and lack of quality time with their children. And lastly, with 33.3%, recipients believe their stressors not being able to support their children, or having a present parent. Several analyses are possible after obtaining and examining the findings from the survey process. Out of the 9 nurses that were surveyed, all worked directly with the COVID-19 virus. Therefore, all of the nurses that are in my survey can be used for the conclusion of my research. However, a few of the nurses' responses contrasted with one another. For instance, although the recipients' responses showed that 33.3% believe their workload has not changed, recipients' responses were that 77.8% experienced an increased burnout level because of the COVID-19 pandemic. This shows that there is not a high of a correlation between workload and the burnout level as had been hypothesized. Overall, the recipients showed an increase in both mental health gradation, with an 88.9% of increased anxiety, 33.3% of an increase in depression, and 100% of nurses having stress. Additionally, there was an increase in burnout levels, with 77.8% of the nurses with an increased burnout. Therefore, there is a correlation between COVID-19, mental health, and burnout levels in nurses. After conducting this research, the results were somewhat accurate to the initial hypothesis. The initial hypothesis that there will be a majority that has problems. However, some may say the opposite because this kind of work is stressful and chaotic, maybe the environment they thrive in. This hypothesis was developed based on conclusions of studies examining nurses' mental health changes from before the pandemic compared to after. Furthermore, the results from the survey concluded all the nurses have experienced a high level of stress, high levels of anxiety, with a low level of depression and burnout. The quantitative data from the survey responses provided statistical evidence to show the correlation between COVID-19 and nurse mental health and burnout levels. The research was narrowed down by the existing field of research. When the perceived correlation between nurses and a decline in mental health was exposed, the research was narrowed down to decipher the correlation between COVID-19 pandemic and the mental health rates and burnout rates in nurses while working through this pandemic. The research will add to the existing body of research by adding a correlation of the burnout along with the mental health for the research. In summary, there will be a correlation between the COVID-19 pandemic and the mental health rates of the burnout of nurses. There were significant limitations to the study, and as a result, the findings were not as widely spread. For future research, it is recommended that there are either more surveys sent out to different locations for advanced home health, or there are interviews instead. Although there may be fewer responses with the interviews, there will be more in-depth answers to find the information for the gap in the research. Questions could have been answered dishonestly because of the lack of face-to-face questions while conducting a survey. Therefore, doing one of these two things would overall benefit in finding a more depth understanding of the research. Thank you.
Good job. Nicely done. So, how did you determine which results generated by your research method were most important when you were informing your new understanding?
Whenever I initially started the research process, I thought that everybody would have an increased level of anxiety, depression, and stress. However, it did not come out as expected. So I think that the importance of the survey, having the survey instead of an interview to get the research process was that, because I feel if we had an interview, the results would have came out differently because of the face-to-face questions rather than a short survey sent to their email.
So what are the real-world implications or consequences related to your findings?
I believe that nurses, administration of nursing, hospitals, and the non-medical community should be informed, because nurses need to be informed that it is okay to feel this way and it is normal during the COVID-19 as workloads have increased. Administration needs to be informed in order to understand that there needs to be prevention strategies and help the nurses with their mental health, maybe like therapy and making sure that they are okay during these times. And the non-medical community needs to be informed as well, because nurses do take care of them during these times and are the main support system during COVID-19.
And if you could revisit your research process, what would you do differently and why?
I would conduct an interview instead of a survey. Although the interview can be more personal, the survey was not as widely spread as I hoped. It was only sent out to 12 recipients and only 9 responded. I was able to find the gap in the research, but I feel like even if I had the same number of recipients answer as an interview, the answers would be more in depth and I would be able to explain the gap better and get a better understanding of how the nurses feel during these times.
All right.